So protect fully. What CoCardio is doing is using a technique called enhanced external counterpulsation, or ECP, which is a technique where they put blood pressure cuffs essentially on your calves, on your thighs, and on your butt. And these blood pressure cuffs will inflate as your heart's filling and literally push the blood flow back up to your heart. They'll deflate when your heart is pumping. So it's almost like it's not really a suction effect, but I think you can think of it in that way. When the cuffs deflate, it makes it easier for the heart to pump out. When the cuffs inflate, it's pushing the blood flow back into the heart arteries and down to the heart muscle. And that is promoting better blood flow to your heart muscle. You're born with 3 major heart arteries and some major branches off of that. But if you have a blockage, you can't get the blood flow through the blockage. So in the conventional cardiac world, we use ECP for what we call refractory angina. You've got blockage, we can't stent it, we can't bypass it, and you really are stuck with just medications trying to limit your chest discomfort. Sometimes it works, sometimes it doesn't. If it doesn't, we recommend ECP, and what it's doing in those patients is it's promoting what we call collateral blood vessels. If you think of a blocked artery and a blocked branch, there's just not many pathways downstream to that heart muscle. Collaterals are like giving yourself a bypass. There's a collection of multiple new blood vessels that branch off of the blood vessel and redirect that blood flow to that heart muscle, which previously wasn't getting enough blood flow. And now you're developing new pathways of blood flow to that area and improves the blood flow. What CoCardio is doing is they're using it upstream. They're trying to promote collateral formation in patients before the problem happens. And I think it's just fascinating. No one else is doing this right now. It would be fascinating to get some amazing data from that effort so that we can see if this is something that maybe this conventional world wants to look at as more of a preventative strategy.